Welcome to Individual Support Plan Guide Training, Module 6, Missouri Quality Outcome Life Domain Areas, Citizenship and Advocacy, Self-Directed Supports, and Conflict Resolution. Personal income is a revised section of the ISP Guide. This section was formerly called Management of Personal Funds. A personal income exploratory question has been developed to assist the individual and person-centered planning team with having meaningful discussions on potential support needs in order to meet HCBS requirement of control personal resources. Additionally, the new exploratory questions assist the ISP team with coordinating supports based upon individualized assessed need to facilitate informed choice of support and setting options. ISP document requirements include supports or personal outcomes discovered during the assessment process as part of planning. This is new. Supports needed to maintain benefits. Supports needed to manage funds. If the individual has a representative payee, provide relevant information. If the individual serves as his or her own payee, what, if any, supports, either natural or paid, are needed to assist the individual? For those who receive residential supports, the individual's resources were considered when given options for residential room and board. What housing resources, i.e., vouchers and other rental assistance options, were explored? The individual was given the information necessary to make an informed choice regarding housing options. Information regarding how the individual wants to spend or save his or her excess funds after daily living expenses are paid. Dental insurance, burial plans, leisure activities, etc. This is mandatory for residential services. Also for residential services, if the individual lives in a residential setting, what is the monthly personal spending allowance? What support does the individual need to manage or access these funds? This section also includes support needed in preparation of application for SSI. The Self-Directed Supports Coordinator training goes into detail regarding the person-centered planning process and ISP requirements for self-directed services. Tools available for the planning process and self-directed supports include the Support Broker Assessment and the Personal Assistant Assessment with Training Exemptions. Both tools are available on the Vision website. Other tools available include the Community Specialist Assessment, Guide for Creating Your Own Individual Support Plan when Self-Directing Supports, and the Self-Directed Supports Individual Allocation Tool. If the individual is receiving medical personal assistant, the ISP must list the licensed medical professional who will be providing the training, delegation, and periodic supervision of care. Licensed medical professional as defined by the Nursing Practice Act Chapter 335 RSMO. Supports or personal outcomes discovered during review of the Support Broker Assessment. Personal outcomes must be identified for support broker services, and this has been included because CMS requires that all individuals get the support they need in order to self-direct services. The services being self-directed are listed and what supports are being provided by these services. Personal assistance, community specialist, and support broker assessment is used as the tool. The ISP is used as a training document for employees and must provide enough details for all employees to understand what is needed to provide supports. Personal outcomes must be identified for support broker and community specialist. The guide also includes a backup when the employer-designated representative is not capable or available to manage employees and handling other emergencies. The guide matches current self-directed support process for individuals new to self-directed service and those with a change in allocation. The self-directed service budget allocation tool is completed and matches dollar amount on authorization form. It is important that if an individual is receiving Medicaid state plan personal care services through Health and Senior Services, Division of Senior and Disability Services, that the service authorization system has been checked to ensure that these services are not being self-directed. Does the individual currently or at any time in the past receive consumer-directed services through state plan and/or have an existing employer identification number, or EIN? The choice of settings, providers, and self-directed supports was added to the contact of the ISP to ensure that the HCBS rule is followed. Choice of exploratory questions assist the individual and person-centered planning team with having meaningful discussions regarding choice in order to meet HCBS requirements. Additionally, the exploratory questions assist the person-centered planning team with coordinating supports based upon individualized assessed need to facilitate informed choice of support and setting options. The ISP must document that choice of provider has occurred according to the HCBS rule. How a person has choice of setting and provider will be different based on the individual and their needs, i.e., could be given an individual a provider list or be visiting different locations. It is important to note that self-directed supports is listed as the choice, not the fiscal management services, or FMS. Conflict resolution. The wording on this slide was taken directly from the rule as outlined in the Code of Federal Regulations, or CSR. The ISP must include strategies for solving conflict or disagreement within the process, including clear conflict of interest guidelines for all planning participants. It is required that the ISP provide information for the individual on who to contact if they are unhappy with services or supports, how to make an anonymous complaint, provides a place for dissenting opinions of team members, and that the individual is provided clear information regarding any potential conflict of interest. There is also information specific to minor children or if the individual has a guardian. It is very important to differentiate clearly what is important to the parent or guardian from what is important to the individual. This could be done with a table or specific titling. If the person is a minor child, information from the parent or parents must be included in the plan. Also, you may encounter a situation in which the parents are divorced. It is very important that you are clear as to the stipulations identified in the divorce decree as to the decision-making authority for the minor child. Also note that divorce decrees may extend into adulthood for some individuals and could have impact on who has the final decision-making authority. If the person is an adult with a guardian, information the guardian wishes to include must be included, even if the individual doesn't want it to be. In this situation, it may be applicable to have information in the plan describing how the guardian concerns are being addressed. This concludes Module 6.